Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Olivia Lemon. Today we're talking about breast cancer screenings and new technology used to help with the detection of breast cancer.
1 in 8 women in a lifetime will develop breast cancer. In 2018, approximately 266,000 breast cancers were detected. Invasive breast cancers were detected. 61,000 were ductal carcinoma in situ, and 40,000 women died of a breast cancer. So it's needless to stress the importance of screening in breast cancer. The commonest modality for screening, which has stood the test of time, is a mammogram. While mammogram is a very useful tool, it is not the most perfect tool. And there might be need for adjunct screening measures to improve the cancer detection rate.
What are dense breasts?
Dense breast refers to the amount of connective and fibroglandular tissue in the breast, what we see as white areas on a mammogram. Approximately 50% of women in the US have dense breast. From the mammographic standpoint, we categorize breast into 4 categories. Categories A to D. The category A and B are referred to as the non-dense breast, which is the essentially fatty or the scattered fibroglandular breast tissue. The heterogeneously dense breast, categorized as C, and the extremely dense breast, categorized as D, are referred to as dense breast. It is important to understand that the breast density decreases with age. In women under 50, nearly 60% of the population have dense breast. The importance of knowing breast density is the link of breast density with cancer. 70% of breast cancers are noted in dense breast. 1/3 of these cancers are missed on a routine screening mammogram. Informing patients that they have dense breast has been mandated by MQSA. 36 of the 50 states in the US have what we call the Breast Density Inform Law, in which a woman is informed of her breast density. Massachusetts is one of the 36 states that has implemented the Breast Density Inform Law.
What does the acronym ABUS stand for?
ABUS stands for Automated Breast Ultrasound Screening. 40% of patients in the US have dense breast tissue. So we use an ABUS as supplemental screening for this group of patients to help the cancer detection rate. When you have dense breasts, the tissue is white. So it's looking for a snowball in a snowstorm, which is difficult. So ABUS comes into play here because it looks dark on the ultrasound. So it helps to see the cancers more easily.
The advantage of ABUS is, unlike a handheld ultrasound, we have better coverage of the entire breast. It's more convenient for the patient. It's a shorter scan time. The image quality, with improving generations of the automated breast ultrasound scanners, has improved considerably. And in women with dense breast, it gives them an additional choice that they have another modality and helps allay anxiety and fear.
How does a woman's risk factor play a role in breast cancer screening?
When it comes to identifying which patients would benefit from automated breast ultrasound, it's important to understand that women can be categorized into 3 groups: the ones with the average risk, the ones with the intermediate risk, and the ones at high risk. The women at high risk, which would mean a greater than 20% risk of developing breast cancer, would all benefit from a breast MRI. So we are really looking at the average risk and the intermediate risk. The average risk woman has a less than 15% chance of developing breast cancer. In all of these categories, women could either have a dense breast or a non-dense breast. So in the average risk category, women with dense breast would benefit from automated breast ultrasound.
Can a woman with implants still have an automated breast ultrasound?
Automated breast ultrasound can also be performed in women with breast implants. In fact, on a mammogram, there's a higher chance of implant rupture. Even though we apply a little pressure on automated breast ultrasound, the pressure is a lot less than a mammogram, so there's practically no risk of an implant rupture. Of course, the presence of an implant does complicate the diagnostic reading ability of the radiologist, but that does not mean that women with implants cannot have an automated breast ultrasound. This being October and Breast Cancer Awareness Month, I'd like to use this opportunity to remind all women viewers, please go ensure that you had your mammogram appointment and your mammogram taken. I understand that different societies have different recommendations and it can be a little confusing, but definitely get your mammogram because mammogram does pick up early cancers. The smaller the cancer, the better chance of survival and the better is the prognosis. So please, please get your mammograms done for this year.